Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
the earliest morphological evidence of ovulation on endometrial biopsy is. The earliest morphological evidence of ovulation on endometrial biopsy is basal vacuolation. Then, the most serious complication of clomiphene therapy for induction of ovulation is hyperstimulation syndrome is the most serious complication. Then, true about clomiphene citrate is, in clomiphene citrate commonly causes hyperstimulation syndrome. True, it is used for ovarian induction and multiple pregnancies are seen in 3 to 8% of cases of clomiphene citrate. Then, true about clomiphene citrate is, clomiphene citrate has anti-estrogenic effect. That is the true statement. All the rest are false. Multiple ovulation and multiple pregnancy in clomiphene citrate is seen in 10%. Then, side effect of clomiphene citrate includes all except. Side effect includes it is multiple pregnancy will occur, increased risk of ovarian cancer, and multiple polycystic ovary will also be seen in clomiphene citrate. Teratogenic effect is not seen on clomiphene citrate. That is the reason, because it is not teratogenic and it can induce the ovulation, and that is the reason why clomiphene citrate is used for infertility. Then, a patient presents with infertility with clomiphene citrate presents with sudden onset of abdominal pain and distension with ascites. The probable cause is, here there is infertility with clomiphene citrate and there is sudden onset of abdominal pain and distension of ascites. So this is due to hyperstimulation syndrome. Then, GnRH analog may be given in all of the following except. GnRH analog can be given in prostate carcinoma, fibroma of uterus, and it can be given in precocious puberty, but it is not given in endometrial carcinoma. GnRH analog can be given either by continuous method or by discontinuous method. So if it is given by continuous method, it will inhibit the production of LH and FSH. So if you give GnRH analog by continuous method, you will give it in precocious puberty and prostate cancer.
thank you and thank you for watching.